Hello and welcome. Today we're diving into the complexities of sickle cell nephropathy, a kidney disease affecting individuals with sickle cell disease. We'll explore its causes, how it impacts the kidneys, and what can be done to manage it. So, let's get started. Sickle cell nephropathy stems directly from sickle cell disease, a genetic disorder affecting red blood cells. In this disease, normal, round red blood cells become rigid and sickle-shaped. This abnormal shape is due to a mutation in the gene that tells your body to make hemoglobin, a protein in red blood cells that carries oxygen. When these sickle-shaped cells travel through small blood vessels in the kidneys, they can cause blockages and damage, ultimately leading to nephropathy. The pathophysiology of sickle cell nephropathy is multifaceted. The sickled red blood cells obstruct the tiny blood vessels, called capillaries, within the kidneys, particularly in the medulla, the inner part of the kidney. This obstruction leads to ischemia, or a lack of oxygen, which damages the kidney tissue. The repeated episodes of ischemia and reperfusion, the restoration of blood flow, trigger inflammation and scarring, eventually impairing the kidney's ability to filter waste and regulate fluid balance. One of the earliest manifestations is often an impaired ability to concentrate urine, leading to nocturia or frequent urination at night. Over time, this damage can progress to chronic kidney disease and even kidney failure. Sickle cell nephropathy affects a significant portion of individuals with sickle cell disease. Prevalence estimates vary, but studies suggest that a substantial percentage, possibly up to 1/3 or even more, of adults with sickle cell disease will develop some form of nephropathy. The severity and progression of the kidney disease can differ based on factors like the specific genetic mutations, access to healthcare, and overall disease management. It is important to note that the impact varies based on the geographic prevalence of sickle cell disease. The signs and symptoms of sickle cell nephropathy can be subtle in the early stages. One of the first indications is often nocturia, or frequent urination at night. As the kidney damage progresses, individuals may experience proteinuria, which is protein in the urine, hematuria, which is blood in the urine, swelling in the ankles and feet, also known as edema, high blood pressure or hypertension, and fatigue. In advanced stages, symptoms related to chronic kidney disease, such as nausea, vomiting, loss of appetite, and itching, may also be present. Diagnosing sickle cell nephropathy involves a combination of clinical evaluation and laboratory tests. The presence of sickle cell disease is a primary clue. Urine tests are conducted to detect proteinuria and hematuria. Blood tests assess kidney function, including measuring creatinine and blood urine nitrogen and BEN levels. A decreased glomerular filtration rate (GFR) indicates impaired kidney function. A kidney biopsy, where a small sample of kidney tissue is examined under a microscope, may be performed to confirm the diagnosis and assess the extent of damage. Imaging studies like ultrasound or MRI can also help visualize the kidneys and identify any structural abnormalities. While sickle cell nephropathy doesn't have distinct classifications in the traditional sense, its severity is often categorized according to the stages of chronic kidney disease, or CKD. These stages range from stage 1, with minimal kidney damage and normal or increased GFR, to stage 5, which represents end-stage renal disease and requires dialysis or kidney transplantation. The treatment and management of sickle cell nephropathy are focused on slowing the progression of kidney damage and managing associated complications. Blood pressure control with ACE inhibitors or ARBs is crucial to protect the kidneys. Pain management is also important to address pain crises that can exacerbate kidney damage. Hydroxyurea, a medication used to stimulate fetal hemoglobin production and reduce sickling, may have a protective effect on the kidneys. Blood transfusions can also reduce the proportion of sickle cells. For advanced stages, dialysis or kidney transplantation may be necessary to maintain life. Preventing sickle cell nephropathy involves comprehensive management of sickle cell disease. Early diagnosis and treatment of sickle cell disease are essential. Regular monitoring of kidney function through urine and blood tests is crucial to detect early signs of nephropathy. Maintaining adequate hydration, managing blood pressure, and avoiding nephrotoxic medications can help protect the kidneys. Genetic counseling for families with a history of cell disease can help prevent future cases. The prognosis for sickle cell nephropathy varies depending on the severity of the kidney damage and the effectiveness of treatment. Early diagnosis and aggressive management can slow the progression of the disease and improve outcomes. However, in some cases, sickle cell nephropathy can lead to end-stage renal disease and the need for dialysis or kidney transplantation. Recent research focuses on developing new therapies that target the underlying mechanisms of kidney damage in sickle cell disease, such as antioxidants and gene therapies to prevent sickling. Researchers are also exploring novel biomarkers to identify individuals at high risk for developing nephropathy. As we conclude, remember that proactive management and ongoing research are key to improving the lives of those affected by sickle cell nephropathy.